Federal prosecutors have charged 6 Michigan doctors in a $464 million healthcare fraud scheme that resulted in 13 million doses of opioid painkillers being illegally prescribed to patients. Here to discuss the details of the story is RT correspondent Brigida Santos. Brigida, how significant is this case in the fight against opioids?
Farron, this is incredibly significant. The opioid crisis has gotten completely out of control, and this case is just one of many examples. Now, for years, as you said, 6 doctors at 3 Michigan pain clinics that were owned and operated by the same person illegally prescribed over 13 million opioids to patients suffering from joint and spinal injuries. Now, the 56-count indictment outlines how the doctors submitted over $450 million in fake claims across Medicaid, Medicare, and Blue Cross of Michigan so that they could personally get rich off the reimbursements. Not only did they create fake claims, they also reportedly prescribed opioids to patients so that they would get hooked and keep coming back for more. And they also gave up to 70 patients per day unnecessary painful back injections and other treatments and tests in exchange for these drugs. Now, the fact that this is going to trial is a huge deal because it signifies that the DOJ is finally cracking down on doctor drug dealers.
You know, what's really interesting to me, too, and you hit it on the head there, is that they become addicted and they keep coming back. When you prescribe a non-addictive painkiller, you don't end up with that long-term patient. So that's really the key here, is you have to give them something like an opiate that is highly addictive to create that repeat customer. So how long did federal officials actually monitor these pain centers before raiding these offices and shutting them down?
It's actually unclear when they started monitoring the clinics, but it was likely very recently, since the doctors were still illegally writing opioid prescriptions as of last month. Now, this scam began back in 2013, and it took many agencies to investigate, including the U.S. Department of Health and Human Services, the FBI, and also the DEA. Now, the mastermind of this scheme, Dr. Rajendra Bothra and his co-conspirators, they managed to cheat the federal health care benefit program and defraud taxpayers for a really long time before anybody noticed this. But still, it's really good that they did get caught.
So some states like Missouri want to limit opioid prescriptions to a 1-week supply. Are any other states taking any kind of aggressive approaches to combat this opioid epidemic?
They are. Now, so far, Florida and Tennessee have taken similar measures, and also, surprise, Michigan has too. Back in July, Michigan passed a new law prohibiting doctors from prescribing more than 1 week's supply of opioids at a time. But the problem with this law is that it only applies to patients who suffer from acute pain, like broken bones, not people who are suffering from chronic pain. While this law is positive in combating the epidemic, it's obviously not enough if doctors can just turn around and prescribe millions of opioids to people who have long-term pain.
There are so many alternatives to opiates right now. In the case of a lot of people, not all of them, but a lot of people who do suffer from chronic pain, whether it's from a car accident that leaves lingering permanent damage, there are things that can be fixed with physical therapy. There are things that can be fixed, episodes of chronic pain, with just minimal, exercise a couple times a week. There are other non-opiate painkillers out there available. There's medical marijuana cropping up that has been proven to actually get people off of opiates. I mean, in areas where marijuana has been legalized, both recreationally and medicinally, the opiate use rate drops. So there are so many alternatives out there. Doctors know about these pain clinics know about them, but they're always, not every doctor, but you got too many out there, and this story kind of confirms it, that we have too many out there who are in it for the money, who want to make as much profit as possible. They want to work for this massive healthcare corporation instead of working for their patients. And that's part of the problem with American healthcare today, is that it's all about profits, and it's no longer about caring and doing what is best for your patients. Brigida Santos, thank you very much for talking with us today.